G'day, Melany Pollock here, the oral health therapist from Plaza Dental. Today I wanted to talk to you about something that gets asked all the time at work, and that is an electric toothbrush better than a manual toothbrush? Now the answer to this question is sometimes. So when we're looking around in your mouth, we're looking for obvious things such as decay and gum disease and things like that, but we're also looking for signs of wear. So sometimes that can show itself in your mouth when we notice that you have some toothbrush abrasion around the side of your teeth. Also, if we notice that your gums have receded a little bit. Now, quite often this is caused by pretty hard scrubbing. So basically, sometimes that tells us that we need to either one, modify your brushing technique, or maybe suggest something a little bit different. So for you hard scrubbers out there, an electric toothbrush can be a lot better because it's a lot less technique sensitive. It doesn't let you push too hard on the toothbrush. It has pressure sensors, and it's a different technique. So you just move it across the gum line and the teeth. You don't actually have to move and scrub. The other time that an electric toothbrush can be a lot better for people is if they're using the wrong end of the toothbrush anyway. So they've got poor plaque control, there's plaque everywhere, the gums are bleeding. It has been proven to actually be better for those people because it's, again, a lot less technique sensitive. It does all the work for you, and we often find that those people come back and their mouths are in a lot better condition. It also comes in handy for those with poor dexterity, so maybe older patients, people that suffer arthritis, special needs patients, so a lot of cerebral palsy patients. They can seem to move the electric toothbrush around a lot easier, which is good. And the other thing I've noticed lately is that electric toothbrushes have been a little bit more of a motivating factor for kids. So parents, if you're out there and you're struggling, sometimes that novelty of an electric toothbrush can be kind of a little bit of a kickstarter. You still need to be careful with how you're using it because it is different. So make sure that you ask your dental professional about that. So the advantages of an electric toothbrush is they almost always come with a small head, which is good for those hard to reach areas. It's a lot less technique sensitive, like I said. It doesn't let you brush too hard. The disadvantages, well, they're more expensive to replace, to buy. They're a lot bulkier, so sometimes it can be hard to travel with them. And last but not least, they need to be charged. So if you've been slack or forgotten, you won't have a toothbrush. Which brings me to my next point. If you have gone to see your dentist or hygienist and they're really happy with how everything looks and you use a standard manual toothbrush, don't go buying an electric toothbrush, just keep doing what you're doing. You're obviously doing a really good job. It all comes down to technique. So whether you're using an electric or a manual toothbrush, as long as you use them, either one effectively, then you are going to be doing a good job. It doesn't matter which one that you use. So the main thing to look for when you're looking for any type of toothbrush is that you purchase a toothbrush with a small head so it can get to those hard to reach areas, and also that you're looking for a toothbrush with soft bristles. Anything harder than that has been proven to destroy the tooth and cause the gum to recede, and once those are gone, you don't get them back, they don't grow back. So that's just something to remember. Here's my beautiful tooth model. I didn't have any volunteers for me today. So basically, with an electric toothbrush, most electric toothbrushes that you purchase will have a one button push function, and it just goes on. Once you press it, it goes for 2 minutes, okay? Now basically what you want to do when you use an electric toothbrush, the idea is that you let it do the work for you, so you need to make sure you're doing this right. So when you do it, you want to hold the toothbrush up at the gum line, and it's really important that you just move it slowly across the gums. Alright, nice and slow. So what we normally recommend is that you divide the mouth up into 4. So you split it down the middle and then that way. So you should spend about 30 seconds in each area. So once you've done all the outside surfaces, try and have a systematic approach to this. Do it inside. Maybe move the back around a little bit. Maybe on the bottom surfaces. And then last but not least, maybe do the inside. Okay? So hold the toothbrush and direct it down towards the gums. I always recommend for my patients to kind of point the bristles up towards the gum line, meant to hold it at a 45-degree angle. When you use a standard manual toothbrush, okay, what you'll need to do is you point your bristles up towards the gum, okay, and it's just nice big circles. So I'll bring it back around here. So nice big circles. And then you try and make systematic process, so try and the inside of these bottom ones to put the toothbrush up like that. Okay, happy brushing.